Bismillahirrahmanirrahim. Today's topic of our discussion is suboccipital triangle. Sub, as the name shows us, this is the triangle that is present in the or below the occipital region. The content we are going to see in this presentation is the contents of the back of the neck, skin, superficial fascia, deep fascia, muscles of the back of the neck, and then occipital triangle, its introduction, exposure, boundaries, contents of the suboccipital triangle, and its clinical relationships. Introduction. The back of the neck is limited above by the external occipital protuberance, superior knuckle lines, and below by the spine of the C7 vertebra. The important structure on the back of the neck include ligamentum nuchae, extensor muscle of the neck, suboccipital triangle, arterial and isthmus muscles around the semispinalis capitis. The contents we are going to see on the back of the neck are divided into the four layers: skin, superficial fascia, deep fascia, and the muscles. The muscles included in these regions are the trapezius, splenius capitis, longissimus capitis, levator scapulae, splenius cervicis, semispinalis capitis, and semispinalis cervicis. Skin. The skin on the back of the neck is continuous with the rest of the body, and the cutaneous nerve which are going to supply that skin are the medial branches of the dorsal lemma of C2, C3, and the C4. You can see that this is the great You can just see this nerve. This is the greater occipital nerve. This one. This is the greater occipital nerve. This is the most important and the most thick. This is the thickest cranial nerve on the body. This is the thickest cutaneous nerve which is present in the body. This is going to supply the skin over the back of the scalp, and then you can see the cutaneous branches of the C3, and then these are the cutaneous branches of the third cervical nerve, and these are which are providing the cutaneous innervation on the back of the neck or the nape of the neck, and the cutaneous branches of C3, C4, and the C5 which are providing the rest of the back of the neck. So we can see the cutaneous innervation which are supplying on the back of the neck are by means of the greater occipital nerve, third occipital nerve, and the fourth and the fifth occipital nerve. They are the greater occipital nerve, third cutaneous occipital, and the cutaneous branches of C4 and the C5. The superficial fascia that is lying just below the skin is very thick, although it is laden with the fat, but it is very thick and tightly adherent. And the cutaneous innervation are by means of the greater occipital, third occipital, and the cutaneous branches of the C4 and C5. The arteries which are going to see in this region are the occipital artery and some minute tract from the vertebral artery. Then underlying the deep superficial fascia is the deep fascia. The deep fascia of the neck is known as a knuckle fascia. It is attached to the median plane to the spine and the supraspinous ligament and the ligamentum nuchae. The ligamentum nuchae is a triangular sheet of the fibroelastic tissue that form in the medius fibrous septum between the muscle of the two sides of the back to which it is attached under the deep fascia. It presents the superior, anterior, and the posterior border. If you can see, I can mark the ligament nuchae roughly on this. This is the supraspinous ligament present on the spine of the vertebrae from the C7 till the external occipital protuberance and the highest knuckle lines, superior knuckle lines. This is the triangulated appearance. This is basically the supraspinous ligament of the cervical region, joining the spines of the cervical vertebra. Then we see when we remove the skin, superficial fascia, and deep fascia of the back of the neck, we come across the group of the muscle which are present underneath. These muscles are present in the various groups, and the first group of the muscle in the first layer you are going to see is the trapezius muscle. When you are going to dissect the trapezius muscle and you are going to cut the trapezius muscle, you will come across the semispinalis capitis, this one, and then this is the splenius cervicis. Then you are going to see the levator scapulae, splenius capitis, and longissimus coli. These are the muscles which are present over the back of the neck. Although the names are difficult, but these are the muscles which are present underneath the trapezius muscle in the form of the four layers. The first layer consists of the trapezius, and the second layer consists of the levator scapulae. Now, what is this trapezius muscle? The trapezius muscle is a large triangulated muscle. This one is the large triangulated muscle. This is going to arise from the external occipital protuberance, superior knuckle lines, and then the supraspinous ligament till the level of the spine of the C7, and it is going to insert onto the spine of the scapula, acromion process, and then anteriorly over the back side of the clavicle. Again, if we can see the attachment, you can see from the external occipital protuberance and superior knuckle lines. This is the supraspinous ligament, or the till the C7. From here, the muscle goes to the level of the T12 and then converging to form one single tendon that is going to insert over to the spine, and then acromius process, and then the in front onto the back side of the clavicle. The nerve supplied to this muscle is by means of the spinal part of the accessory nerve and the ventral rami of the C3 and C4. What is the function of the trapezius? The trapezius help to elevate and shrug the shoulder, and also help to retract and steadying the scapula. Levator scapulae. The levator scapulae is the muscle that is present in the second layer of the muscle which are present at the back of the neck. It arises from the transverse process of the first four cervical vertebra, and it is going to insert over the medial border of the scapula. Its action is again to elevate the scapula, like from the origin to insertion. If it is going to contract, it is going to elevate the scapula, and it is supplied by the anterior rami of the C3 and C4. The deeper muscle which are present are arranged in the form of the four layers. External layer is consisting of the splenius capitis and the semispinalis cervicis. Splenius capitis and splenius cervicis. Intermediate is the longissimus capitis and longissimus cervicis. Capitis is the cap that is present on the back side of the occipital bone. Cervices are present in relation to the neck, like this one. One pair of the muscle is present on the back side of the occipital region, and other pair of the muscle is present on the neck. So that is why they are arranged in the form of the two. That one part is known as capitis, that is present at the back side of the occipital bone, and other part is present in the neck. So that is present. That is why on that cervical vertebra, reference to the cervical vertebra, these are known as the cervices. So they are consisting of the two parts, splenius capitis and the splenius cervicis, longissimus capitis and longissimus cervicis, semispinalis capitis and semispinalis cervicis, suboccipital muscles. Now the suboccipital triangle. The suboccipital triangle is a muscular triangle that is present deep into the suboccipital region on the each side of the neck, on the each side of the midline. It is bounded by the three muscles that are included in the suboccipital group of the muscles. In order to approach this triangle, you have to dissect out the skin that is very thick. Superficial fascia is fibrous and dense. Then you can see the trapezius and then sternocleidomastoid. You have to cut down the splenius capitis and semispinalis capitis, and reflection of the semispinalis capitis is going to expose the suboccipital triangle. Now, if you want to see the boundaries, then you will see the suboccipital muscle. The suboccipital muscle, you can see the first muscle is the rectus capitis posterior major. This one is the rectus capitis superior major. Red one is the oblique capitis inferior, and the green one is oblique capitis superior. The muscle which are going to enclose a region that is known as the suboccipital triangle, and roof again is formed by the medially formed by the semispinalis capitis and the longissimus capitis, and the floor is formed by the posterior arch of the atlas. If we see the boundaries in this portion, this is the midline. It means this is the medial boundary and this is the laterally. So supromedial boundary is formed by the rectus capitis posterior major and rectus capitis posterior minor. Inframedial boundary is formed by the oblique inferior, and supralateral boundary is formed by the oblique superior. Contents of the suboccipital triangle include the suboccipital plexus of the vein. This plexus of the vein is very much important because this plexus of vein is going to communicate not only with the brain but also with the rest of the veins around the vertebral column. So by the means of this plexus of the vein, the whole body, the venous system of the whole body has been communicated with each other. Then third part of the vertebral artery. The vertebral artery, before entering into the brain and supplying the brain, it is going. You can see this part of the vertebral artery when it exits through the foramen transverse of the atlas vertebra. Then dorsal ramus of the C1 suboccipital nerve. It emerged from the posterior arch of the atlas and the vertebral artery. Soon it break up into the branches and supply the floor of the occipital muscle that is formed by the atlas. Then clinical relation, the neck rigidity occurs in the meningitis due to the spasm of the extensor muscles of the back of the neck, which we have just studied. The posterior cranial fossa is approached by the neurosurgeon to remove the brain tumor by clearing the suboccipital muscle and removing the exposed bones. The connection between the suboccipital venous plexus and internal venous plexus, that is around in the subdural space, serves as a pathway for the intracranial infection in the carbuncles of the neck that become very dangerous, that the carbuncles or the infection or the abscess of the neck can lead to the infection into the brain. That's all for the suboccipital triangle. Hope you have understood it well. Thank you so much.